Well, we want to welcome you to Retirement Real Talk. My name is Marvin Music, along with my son Joshua. Today we're going to cover a very, very important topic, and that is the 6 mistakes that we see people make all the time when they decide upon their Medicare plans. And then we're going to answer some of the questions that our audience has posed. Let's get started.
Welcome to Retirement Real Talk, where we cut through the advertisements, sales pitches, and all the confusion surrounding Medicare, Social Security, and retirement finances. Introducing the Internet's leading Medicare educator and co-founder of MedicareSchool.com, Marvin Music, and his son, certified financial planner and the co-founder of MedicareSchool.com, Joshua Music. It's time for some Retirement Real Talk.
The first mistake that we see people make that we feel like we need to warn people about is enrolling into an Advantage plan because they think it's free. So a lot of people out there have that opinion. So I guess the question for you is, why do people think that?
Well, because the ads usually mention 4 zeros, free, 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 free. And there are a few things that are going to be free, you know that. They can see their primary care doctor for free. They can go to the gym for free. They can have a drug plan that's included, for free.
Maybe free dental, free eye care.
Exactly right.
Like
so
that.
There definitely are some few free items. But the bulk of things are not going to be free. They're going to be responsible for co-payments, co-insurance, sometimes a deductible. And so people find this out when they get sick and they need services, and they're going to understand that it's not free. But, being free appeals to everyone. Who wouldn't want something that's going to be free? But we all know there's no free lunch.
So then how do these plans actually work? So as opposed to, this message that, hey, it doesn't cost anything, what are their costs going to be, if they have some health issue come up? Sure.
Well, first off, they're going to have to be enrolled in Medicare A and B. A is free, but B has a premium. So anyone that's in an Advantage plan has to be enrolled in Medicare B. So that's right now $170.10 a month. Comes out of the Social Security check, or they bill them for it. So they start off being eligible for the plan and going to have to pay to be on the plan. Yeah. And then what happens is the plan is going to put together a schedule of copays. When someone goes to the hospital, it's not free. Okay. It's averaged about $350 a day to a certain limit, 5 or 6 days. And
which means if they go in the hospital, what is that, $350 a day times 5 or 6 days, so maybe $1,800, $2,000, they're going to come out with a bill or a copay that they have to pay.
Exactly right, yeah. Or even simple things like an MRI or a CAT scan. Those are $200-$300 per test. If they go in for like an outpatient surgery, a very reasonable copay, but it's not going to be free, usually $300-$400 for that. So it really is a pay-as-you-go plan. And so what's basically happening on the Advantage plan is people are assuming the risk of whatever healthcare cost they're going to need that year up to that limit, max out of pocket. Yeah. So the advertisements make everyone feel like, well, why wouldn't you do this? Well, there's a lot of reasons why you wouldn't want to do this.
Yeah. And we've talked about some downsides. So what are some of those, other than the costs?
Really, right? Josh, to me, the biggest one that I try to really warn our clients about is the pre-authorizations. I think it's the biggest deal. In fact, just last week we had a guy call in that wanted to get his wife off her Advantage plan and go on a supplemental plan, and the reason because she needed a knee replacement, and the Advantage plan wouldn't cover it. Doctor said you need a knee replacement. Advantage plan had the final say so, and it was denied, and so he wanted to switch her. Well, she needs a knee replacement. No one's going to let her do that. So that's what happens, and so this is the biggest issue. I've had a couple situations last year. We had 2 ladies who needed hip replacements, and the Advantage plan, of course, has final say so. They have to pre-approve it. And one lady was told go to 9 months of therapy first, and then we'll talk about possible hip replacement. Mm-hmm. Had a lady that was only approved for a rod. She didn't get a full hip. And so those are the things that Joe Namath and all these stars talk. They don't talk about that when the way they're really going to work.
All the pros, none of the cons.
Exactly right.
So for pre-authorizations, obviously, I think people need to know, like, the other side of that coin, other than the Advantage plan, would be having original Medicare, getting like a supplement plan, which in that case, there's really no pre-authorization. So there's no insurance company saying, hey, you can't get this or you can't get that. It's if that's a Medicare covered procedure, then you're gonna be able to get it. The supplemental plan has no say-so in claims whatsoever. So, and it's also, I think, important to, like, we're not talking about death panels here. We're talking about, but the insurance company does have that final say when it comes to an Advantage plan. And then another thing that I wanted to bring up. So, talk to me about networks, doctors, hospitals, that sort of stuff, because supplement plans and original Medicare, there are no networks. So
that's right. Well, every Advantage plan is going to have a network. Has to. That's just the way that they work. Private health insurance companies going to put together a group of providers, hospitals, doctors, different providers, and there are going to be HMOs or PPOs. And the HMOs are a little bit, less options. PPO is going to have more providers. But what happens? These insurance companies make the HMO plans very attractive financially. Less money out of pocket, less co-pays. But you're going to have limited providers. And sometimes people are fine with that HMO network. Other times there's not enough providers, so they may be in the PPO, but they're still going to have a network. And with networks, there are restrictions. Rules. Sometimes a plan requires a referral. Sometimes they want you to see your primary care doctor before you can go see a cardiologist or an orthopedic doc, and so that can be restrictive to people. If we're on original Medicare, we don't have that. We don't have referrals, just like we don't have pre-authorizations. In fact, one thing about pre-authorizations, I know we visited, but I think it's important to note, when someone gets a supplemental plan right on their card, that card says no pre-authorizations. The insurance company has no say-so. If Medicare pays, they have to pay. Not so with the Advantage plan. And if people are comfortable with referrals and pre-authorizations, it's fine. It's not like it's bad insurance, it's just different. And they have to live with that decision. Yeah.
I think another thing that's really important, which kind of takes us into our second mistake, is talking about if you're on an Advantage plan, how do you get off of it? Because a lot of people think you can just switch from plan to plan every year during the annual enrollment period. That's not really true at all. So what we've seen is people who, just like the scenario you gave, is a lady, she wanted a knee replacement, couldn't get through the Advantage plan, wanted to switch to a supplement plan. Well, at that point, that's on your health history. And that supplement plan, they're not going to accept you. You're going to have to go through medical underwriting to get off that Advantage plan onto a supplement plan. And what insurance company would be like, oh yeah, come on over. we're gonna pay $40,000, $50,000 for your knee replacement or whatever it costs right out of the gate. So she would have to get that done, be cleared from rehab, which a rehab under an Advantage plan is like $40, $50 a session. So 3 times a week for 2 months or 3 months, whatever it is. But anyway, that brings us to that second mistake, if we're done talking about Advantage plans. And I think at least sometimes people, I think they say, hey, you guys beat up on Advantage plans. We don't really beat up on Advantage plans. Our team helps. We help right around 1,000 people a month get on different Medicare plans. And I don't know the exact number, but 25, 30, 35% of those people are actually Advantage plans. So we sell thousands of Advantage plans every year. We're not against them. But what we are against are all the commercials saying, hey, it's free, it's free, it's free, you need to do this, and neighbors and friends and all these people pressuring you to get an Advantage plan. And the reality is there are some downsides. So the first mistake, enrolling in an Advantage plan because you think it's free. Secondly, thinking that you can switch your plan every year is a big mistake that we see a lot of people make. So there is an annual enrollment period. That period runs from October 15th to December the 7th. The new coverage starts January the 1st. Annual enrollment period, or technically it's called annual election period, is for switching your drug plan. So if you're on a standalone prescription drug plan, switching that plan to another plan, it's primarily for that, or switching Advantage plans. So in every market, there's probably 25 or 30 drug plans, and there's probably 12, 15, 18 different Advantage plans, depending on where you are. And so that annual election period is for switching that. It is not for switching from Advantage to Sup or Sup to Advantage. That's not the purpose of that period. You can do it during that time, yes. But what we see is a lot of people think, hey, I'm going to get on the Advantage plan and I'm going to stay on that for 2, 3, 4 years, whatever it is, and then something comes up in my health. I'm going to get sick. It happens to most people as we start to age. Then I'm going to switch over to the supplement, the better coverage, and I can do it at that time. That is not true, right? No insurance company is going to take you if you've got a bunch of health conditions going on. Yeah. So the idea that you can just switch your plan back and forth every year is not the case.
Well, the most common issue I see is that people go on Medicare at 65 or close to that. They're healthy. Yeah. And they make this decision, well, why do I want to pay a premium for something I probably will never use? So they go on the Advantage plan. It appeals to them. And in the back of their mind, they're thinking, well, I'll stay on this for a few years and then I'm going to switch before I get unhealthy. Yeah. I had a lady not long ago that was her plan. Put her on an Advantage plan and she was going to switch at 70. And just a couple weeks literally before last year's open enrollment period, she goes to see her dermatologist and she was diagnosed with melanoma. Well, no insurance company is going to take melanoma. Yeah. She's going to have to be cancer-free, treatment-free for 3 to 5 years. And so she's going to be on that Advantage plan 3 to 5 more years. Hopefully nothing else will go wrong with her health. Yeah. So she planned to switch, but she can't. And so people need to be aware of that. That's the rule. We have this open enrollment period, but it doesn't mean you're going to get to switch that plan.
Yeah. Now, for those of you who are on cancer, just heard him say it's a 3 to 5 year look back. That is true. I will tell you though, I was just like an hour ago on a phone call with, there's a company that's rolling out a supplement plan, and they have a 2-year look back for cancer, 2-year look back for a heart attack, and they'll accept up to like 50 units of insulin or something. So they're being kind of aggressive with their underwriting. So it's not all lost for 3 to 5 years, but that's, as a general rule, you're right. Let's teach them just a moment on the Medigap open enrollment period, and that's kind of technical term. So how does that work?
Sure. I think it's important for people to know this, that when you first go on Medicare, throughout the country, everyone is eligible to get a supplemental plan of their choice, whatever company, whatever letter they want to get, with no underwriting. Yeah. And that period of time is tied to the Medicare B date. So if I'm going on Medicare 9/1 this year, 2022, I actually can apply for a supplemental plan, 6 months in advance. But once I start my Medicare B date, in my example, September 1, I have this 6-month window, this opportunity where I can have any Medigap policy that I want, and the insurance company has to take me. Yeah. They don't even have the right to ask me any health questions at all. So during that 6 months, I could be terribly sick, healthy, it doesn't matter, because we don't ask any health questions during that time. We call that guaranteed issue. And the insurance company will issue the policy regardless of health conditions, regardless of pre-existing conditions. So for people that have health problems, this could be their one and only opportunity to ever get a Medicare supplemental plan. Yeah. Now, there are some states that have a little bit more leniency to that, but most states, you just have 6 months. And then after that 6-month window is closed, if you ever want to switch subs or change companies, change letters, now we're going to have to go through that medical underwriting process.
And that's true in like almost all the states.
Yeah,
there are a few exceptions
exactly right,
where that's like a year-round Medigap open enrollment period. But
so that's that period of time that everyone needs to know about and not miss that opportunity.
Yeah. Okay, so the third mistake we want to talk about is there's a big myth out here, and we want to dispel it once and for all. And that myth is that you have to go on Medicare when you turn 65. Okay, that's not true. Okay, so a lot of people make the mistake of going on Medicare, but if you are still working and you're covered by a group plan, 20 people or more, or 19?
20 people on the payroll or more, you don't have to.
You don't have to go on Medicare at 65. You can stay on that employer coverage. It's important for everyone to know that is you're actively working, you or your spouse, and you're covered by that plan. There are some instances of people that do have to go on Medicare. So what are those?
Yeah, well, that would be anyone that's in a group employer plan of 19 or less. So that would be 19 people on the payroll or less. Those people have to go on Medicare A and B. And the reason for that is because the group plan is put in the second payer position. Whenever you're in a small group, Medicare pays first, group pays second. So if someone doesn't go on Medicare and they're in a small group, I can assure them, if they have a large claim, that group plan's only going to pay second. And if they didn't enroll in a Medicare like they should have, they are going to be the first payer.
So if you have a $100,000 bill, and let's say Medicare would normally cover 80% of it,
Right.
all of a sudden you're paying 80%, and your group insurance is going to be picking up the difference.
Exactly. And I've seen it. I've seen it happen before. And really, in that scenario, the smartest thing that people can do if they're in a group plan of 19 or less is to come totally off the group plan.
Yeah.
Don't let it be in the second payer position, because someone's probably paying $500 to maybe $1,000 a month for that plan. Your employer and you probably combination. So what we highly recommend, especially anyone that's on a 19 or less in a group, is come off Medicare. Come off the group plan and go on Medicare A and B and get a supplemental plan or an Advantage plan. And oftentimes we'll see employers will give people a pay raise to cover that, because it's really a win-win situation. Employer wins because they're reducing their costs, and you win because you get better insurance at less out of your pocket as well. That's easy to do.
So those that do have to go on Medicare are going to be, if you're 19 or less in your group plan.
That's right, or you have a retiree plan, on a COBRA plan, or on Affordable Care Act plan. Those three groups of people have to go on Medicare at 65.
But if you're if you're turning 65, you're working, your spouse is working, you're covered by that plan, 20 or more, and it's a great plan, it's costing you $100 a month, and you've got low deductible, all that sort of stuff, you do not need to go on Medicare. So that leads us to the fourth mistake.
Yeah, but let me mention just one thing about that. Here's another thing people do in this situation, Josh, and that's that. Let's say that one spouse is working, one spouse are retired, and they're receiving Social Security. Anyone that's receiving Social Security is going to be automatically enrolled into Medicare A and B. So this retired spouse, who's covered by the employer plan of the other spouse, gets their A and B card, and they keep the card. And they're going to start paying for their Part B. That's a big waste of money, right? What they should do is return the card and take A only, hospital only. Okay. If that group plan is good, they do not have to stay enrolled in Part B. And then when retirement comes for both, then they enroll in B at a later date. And that's a big mistake people make.
So if you're turning 65, you're on Social Security, you're going to be auto-enrolled. So look for that card in the mail, sign the back, send it in to make sure that you don't keep Part B. Otherwise, you might be covered on a group plan, but you're also out here paying $170 a month for Medicare, and Medicare is not a great secondary payer, so that usually doesn't make sense.
Yeah. So the whole point is, if someone has that group plan of 20 or more, they don't have to keep B. They can delay B. If anyone is not on a group plan, they're going to keep the Medicare card, but that group of people that have the group plan don't have to. So we don't want folks to make that mistake, because it's a big one.
Yeah, well, it costs a lot of money. And then the last thing I forgot we were going to mention on that is, whenever you do, let's say you have A and B while you're working, right? And then you come off down the road, maybe you're 67, 68, 69, and you retire. You are now, because you went past your Medigap 6-month open enrollment period, now you're going to be very limited in terms of what plans you can choose, maybe even carriers. So it's just, if you're still working, got great coverage, you don't need to take A and B. You can take A if you want. It's free. A lot of people do that because it doesn't cost anything, but you're not going to be penalized. And if you think about it, it kind of makes sense. So the government would really prefer, I think, that you stay on that group coverage till you're 110, right? Because then they don't ever have to get involved in your coverage and paying for that.
Yeah.
So why are they going to penalize you for being on your group insurance?
They're not going to.
Yeah, they're not going to. They're going to penalize you if you I'm not going to go on Medicare because I'm healthy, and then you're 72, something comes up and you're trying to go on. That's when they're going to start penalizing you.
Exactly right.
So.
Yeah, they're glad they're not liable for you while you're on a group plan. So that's why they make it so easy for people once they retire to come into Medicare. It's very, very easy to do.
Okay. Are we ready for the fourth?
Yeah. Okay. Let's talk about this one.
Not comparing Medicare to group or to employer coverage. So this is kind of the opposite of mistake number 3. So mistake number 4, not comparing Medicare to employer coverage. So if you are working, we see a lot of people who think, well, good, I don't have to go on Medicare. Well, that's also a mistake, because Medicare can actually be pretty attractive. And I would say this is probably a 50-50 shot now on if you should go on Medicare while you're still working. Now, of course, you got to make sure if you do that decision, or if you make that decision, that you're not
really hurting.
You're not hurting anyone else. So there's no spouse that you're impacting. So if you come off the group plan, then all of a sudden she has to go get an ACA plan and spend $800 a month, right? There's no dependents,
covered up to
older
age 26.
kids, on there. But talk to me about kind of how someone could compare Medicare to the employer coverage that they have, assuming it's not going to hurt anyone else.
Very simple, very simple. So we're going to look at 5 aspects of an employer plan to
That's
make a
simple?
decision.
Okay.
Yeah. Well, what's the premium?
I'm just kidding. Okay.
What's it cost to be on the plan?
Premium.
And then what's the deductible, and do you ever meet that deductible? Some people do. I'm shocked. We have people that have a $3,000 deductible and they meet it every year.
Yeah.
So you divide that by 12. That's $250 a month plus their premium. Medicare will be much better than that. So we look at premium, we look at the deductible, co-insurance. After they have met their deductible, do they have additional responsibility? Most times they do. 80-20. Plan pays 80, they pay 20, or maybe 90-10. And then the max out of pocket, and that comes up when people have a serious illness. So if someone gets cancer on a group plan, it's normally going to cost them $10,000 or $15,000 out of their pocket. A lot of risk. And then also medications. And so when it comes to medications, if people are on very inexpensive meds, then that's
no big deal.
Yeah, no big deal. But when it comes to expensive meds, sometimes we will have people, I'll tell them just stay on their group plan because the group plan is probably going to offer them better prices. But that's what I'm going to look at, financially, those items. And then, as you said, will anybody be impacted adversely if I go on go on Medicare and get off the group plan? So spouses or kids covered at 26. We want to watch for that. In fact, I just had this happen. Helped a guy recently that worked for a car dealership, and it was a large group plan, but it was costing him $700 a month in premium for himself. Okay. Well, we beat that at half. Medicare's half that.
Yeah.
And he had a very low deductible. So again, if you're going on Medicare, you're eligible for it, just compare the group plan to Medicare. And if it makes financial sense and no one else is hurt by it, then by all means go on Medicare. Your employer will be happy and you'll be happier as well. You'll save money and really have very, very good insurance.
Okay, so if we were going to give everyone, and this is going to be broad, so we're painting with a really broad brush here, but almost a rule of thumb. Mm-hmm. So you can go on an Advantage plan on Medicare for about $170 a month, meaning the Advantage plan is free, Part B premium is $170. Knowing with that, you're going to pay copays, and then maybe your max out of pocket is going to be $3,000, $4,000, $5,000. So if you're on so that's option 1. Option 2 is going to be a supplement plan. So maybe that's $275, $300, $325, somewhere in that range. That's going to be your all-in premium, meaning the supplement plan, the drug plan, and the Advantage plan. Mm-hmm. With that, you're going to have very low out-of-pocket after that. Maybe if you're on a Plan G, a $233 deductible and max out-of-pocket. So you kind of have those worlds. So as you're looking at the employer coverage, if you're on a plan that's costing you
$250 or up.
Okay, $250 or up.
That's right.
And then max out-of-pocket of $2,000 or up, mm-hmm. $2,000, $3,000 or up, then you probably need to be comparing Medicare.
Exactly right. Yeah. Well, and in addition to that, we had a lady we just helped in St. Louis, husband and wife, both eligible for Medicare. He's retired on her group plan. And so we found out with them what the employee-only premium was. It was $100 a month for her. Mm-hmm. Employee plus spouse premium jumped to $500 a month. So what does it cost her to cover him? $400 a month. And so my advice to them was for her to stay on her group plan at $100 a month. That's a good deal. And for him to go on Medicare, and that's what they did. He lowered his premium and got better insurance. Yeah. Okay, so we need to look at all of those factors.
Do we want to make a shameless plug here for our company?
Go right ahead.
Okay, so if you need assistance with comparing this or anything that we talked about, our company, MedicareSchool.com, right now we help about 1,000 people a month compare their options, find the best rates, find the best long-term price stability, get enrolled in A and B. We'll even help you get enrolled in Social Security. It's the whole gambit. We're going to hold your hand through this whole process. Our services are free because we are independent insurance brokers. So we focus on education, helping you find the best coverage, and then servicing you for life. And really, that last portion's where I really feel like we have been pouring a lot of energy in lately, making sure our support staff is really beefed up to make sure that when our clients call in, they're getting the help and the answers that they deserve. So if you need any assistance, we would love to assist you. Okay.
Yeah, I just want to add something to that because I think this is very unique to our company, and that is that when someone calls into us, they're calling into America.
Yeah.
They're not going into some call center that's somewhere where they're having
Outsourced, yeah.
difficulty, maybe understanding people, and that happens. But they call, they're going to get somebody here where we care about them,
Yeah.
and we're going to take care of that problem. So it's very important.
So our director or COO here at MedicareSchool.com, he told me yesterday he took a call from somebody who wanted to sell him Medicare. He's not even old enough for it yet, but he took the call, and he said they were, I don't know what country, but definitely non-native English speaking, which is fine. But at the same time, if you're talking about health insurance, it'd be nice to be able to talk with somebody who has that experience. And he said they, I think, asked him like 10 to 12 times if he was enrolled in Part B. And he was like, no, I'm not. Can you help me? And they just kept asking. It was just very, very odd experience. So we really just try to take the guesswork out of all this and really, provide people a really good experience.
That person's just reading a script.
Yeah.
Yeah, they don't have the knowledge really to assist anyone. They're just trying to enroll them in a plan real quickly. So.
Okay. Those are the first four. Let's go into number 5 is going without a drug plan. A lot of people think, hey, I'm not taking any medications, or I'm taking lisinopril, or I'm taking simvastatin or atorvastatin, or just some cheap medication I can get at Walmart for $3 or CVS for $4. And so they just go without a drug plan. And that's not really a good idea at all. The reason being on that, there's really 2. So number 1, you're going to get penalized. And the penalty is not that steep. I'm not going to go to the technical formula because it's technical, but generally it works out to be about $4 to $5 a year. Yeah. So if you went without a drug plan for 5 years, right, you're going to be maybe paying $20, $25 penalty every month for the rest of your life that you're on a drug plan. So, you can get a drug plan right now for $12, $15 a month. Just go ahead and get that drug plan now, because who knows what's going to happen in the future. So the penalty is one thing. The second reason is really because you don't know when you're going to need a medication, and Medicare knows that. And they say, well, if you don't take one when you're first eligible, because insurance only works when everyone's paying some premiums, but if you only take a drug plan when you need it, well, we're going to limit the amount of time that you can actually enroll in that drug plan, which is going to be the end of the year. So let's say it's February, and you get put on a medication that's $500 a month. Say it's Eliquis or whatever. So you get to put on a medication that's $500 a month in February. All of a sudden, you're paying $500 in February, $500 in March, $500 in April, $500 in May, all the way until the annual enrollment period when you can enroll in a plan that'll cover it, and then that coverage starts January 1st. So for 11 months, you ended up spending $5,500 for that medication. So those are the 2 reasons, at least, that I see for why you should get a drug plan.
Yeah, your example is a good one. I mean, that's just for somebody that gets AFib. Yeah. Hey, I have people regularly that we help that are taking self-administered chemotherapy pills. Those are $7,000 a month, every month. We had a guy recently that was on a medication that he said saves his life, $16,000 a month. So what happens with people when it comes to drug plans, when they're healthy and they take no meds, they're tempted to not get them because why? They're looking at today. Yep. They're not thinking about 3 months or 5 or 6 months down the road. And so that's what people cannot fall into, that trap. They also think, well, I can get this cheaper, a GoodRx coupon. And that is true with some medications. But I can tell you right now, if you want Eliquis, GoodRx coupon, it's going to be about $35 off. You're still going to pay $465 for that medication. So it does help with some meds, but not all meds. And we like GoodRx. We're happy about that. But we get a drug plan not because of today, but because of what could happen. Yeah. I always tell people, my home's never burned down, but I'm not about to go without homeowners insurance just because my home hasn't burned down yet, because it could. And so we want to make sure we don't put ourselves in a position of risk if we need a $7,000 a month medication. Because if you don't have a drug plan, you will beg, borrow, and whatever you can to get that plan.
You're calling your family.
That's right. And so you have a Medicare plan, now it's going to be a fraction of the cost.
Yeah. So bottom line, going without a drug plan is risky. You're going to set yourself up for penalties, and you also may not be able to get the medications you need, be able to afford them till down the road. So just get an inexpensive drug plan. I mean, it's pretty kind of a no-brainer. Final mistake that we want to talk about is trying to figure all this out alone and doing it all alone, going on Medicare all alone. Some people try to do that. We always call them do-it-yourselfers when it comes to Medicare, and we really feel like that's risky. So what it means to do it yourself is really you're going to be working through call centers. You're going to be spending hours surfing the internet trying to figure out all the details of these plans that actually exist at some people's fingertips. So nobody likes working with call centers. No one likes getting transferred around. Nobody likes trying to re-explain what they're trying to do. But that's how it is when you do it yourself. You run the risk of making a mistake. You run the risk of not knowing what you don't know.
But the question is, why did people do that?
Well, I think
because they think they're going to save money, right?
Yeah.
Hey, we're both do-it-yourselfers.
Yeah.
I mean, if I feel like I can do something myself, I'm going to tackle that project.
That's true.
And I want to save money. There's no doubt about that. But in this business, you don't save any money by trying to do it yourself. In fact, you could cost yourself a lot of money if you mess it up.
Yeah.
And so, people need to realize, our audience needs to realize, when you try to do it yourself, Josh, I would say this. Probably 1 out of 100 people, or maybe 2 out of 100, could really do it themselves successfully. 98 are not going to be able to, only because not because they're not intelligent. It's because they've never done it before.
Yeah.
And there's a lot of moving parts. And what happens? You could understand 90% of this, but you leave out 10% you don't understand. You haven't connected all the dots, put all the pieces of the puzzle together, and you make that one mistake. And I've seen it over and over again in my career.
Yeah.
I mean, I had somebody not long ago. They made a mistake, Medicare mistake. It cost them $80,000.
I had a guy yesterday. He made a mistake. It's going to cost him a $700 penalty a month.
Yeah, I believe it.
Right?
Yeah,
That's for the rest of his life. So, I mean, hopefully he lives a long time, but $700 extra a month is a lot. That's.
And what's interesting, we have people who make mistakes because they got information from their HR department, or they got it from whomever, and so they act upon that advice. And sad to say, a lot of these they can't reverse it. Now they can still go on Medicare, but they're going to pay some serious penalties.
Yeah, hefty penalties. Okay, so do it yourself. You're going to work through call centers, right? Which means you're calling insurance companies, right? And they're generally saying, well, our plan is best, because after all, if you go to McDonald's, are they going to send you across the street and say, hey, Burger King's a better hamburger? Mm-hmm. No, right? If you call United Healthcare, whatever company, they're going to say, hey, this is the plan you need to go on. That's just how it works whenever you're trying to do it yourself. Another thing is they're very compartmentalized. So you're going to talk to somebody who can tell you about a supplement plan. Then you're going to talk to someone who can help you with a drug plan, and then maybe dental coverage, and then maybe eye care coverage. So you're kind of going all over the place. They're going to be pushing, hey, this is what pays them a commission, and you're kind of left to put all the pieces together and figure that out alone.
That's exactly right.
So, and then down the road, hey, if you have an issue, guess what? You're back to a different person at that call center, trying to solve your issue. Somebody that you don't know, that you've never been associated with, that doesn't know about you. You're one of a million people that are, on that plan or whatever.
Well, in addition to that, I think one of the biggest problems with call centers is that they have just such a high turnover.
Yeah.
We've hired people that have worked in call centers, and so we know exactly that experience. And I would say, for every 3 people working in a call center, 2 of the 3 are in training, and 1 knows what they're doing. Mm-hmm. And it's the luck of the draw. So you call in, and you get someone that may be in the business for a month or 2, and still doesn't really even understand what they're talking about. They're usually reading a script. And so here someone is making a huge decision, maybe a lifelong decision, and they're getting advice from a rookie.
Yeah.
And it's very, very unfortunate, when that happens. So that doesn't mean the people in the call center don't care.
No.
It just simply means they haven't been in business long enough. I mean, it takes a few years to really understand this business well.
Okay, so there's 3 or 4 really big Medicare shops in the U.S., and I'm not going to mention names or anything, but all those TV commercials with celebrities, they're the ones that when you call those numbers, you're getting connected to those call centers. And so we've hired a lot of people out of that frankly hate their job. So we had one lady I'm thinking of. She called us because she wanted to work for us, but we weren't hiring at the time. And she was like, hey, every single day when I go home, I have to cry myself all the way home as I'm driving home because my sales manager over me said, it doesn't matter who you're talking to, what plan they're on, you have to figure out a way to get them to switch plans. Right. So if it doesn't, and one of the examples she gave was, I found a plan for this person that was not in their best interest. the plan they were on was in their best interest. But I found a plan that was in their best interest, but my sales manager said, hey, there's an extra $100 of dental benefit a year, and so that's how you need to push that. You need to convince these people based upon that dental benefit. Well, you shouldn't be switching your health insurance for an extra $100 of dental benefit. And I think, so I don't really believe that the people in those call centers are bad at all, right? A lot of them actually are trying to figure out, how do I help people? But what has happened is a lot of those big shops have gone public. Now they're reporting to shareholders, and they have to have a profit. So what ends up happening is, as that trickles down the effect, all of the people who really got in the insurance industry because they want to help people are now being forced to push people into plans that are paying the company the highest commission.
They're trying to keep their job instead of really take care of people that are on Medicare. It's unfortunate.
Okay, so as you can tell, we're a little bit passionate about that. So if you do it yourself, that's kind of that picture of what that looks like. The other alternative that we really feel is the right one is to work with an independent broker. So you don't have to work with us. You can work with whoever you want to. But here's what I guess we want to do is give some advice on, if you work with an independent broker, here's what you should look for. Okay, so I think first you want to find a broker that's going to write with all the major carriers. Now, guys, I went into a quoting engine today to look up a price for a lady who lived in Colorado, Loveland, Colorado. And she said, hey, this is my zip code. And I looked at the rates, and there were like, I'm going to go 50 different supplemental plan companies. There's probably no broker out there that writes for all of them, and you wouldn't want to go with them. Some of the names of these insurance companies are like Peaking Life Insurance and all these tiny little companies that probably have 1,000 people on their plan. You don't need to write for everything, but the point I'm trying to say is you need to get with a broker that writes for all the big carriers.
Major carriers.
Yeah, because those are the ones that are going to be price stable. They're going to have the best networks, the best options, going to be the most competitive. So look for somebody that's got a lot of plan options. Don't just go to someone who writes, hey, I write for XYZ company and this one. Find one that writes for 20, 30 different options, okay? Secondly, you're going to want to look for somebody that's going to be very transparent with you on the rate history, especially if you're going with a supplement plan. Don't just go into this company because your friend, or this insurance plan because your friend said. You want to find somebody that can tell you about those price increases. So we know that there are certain carriers that are a lot more price stable than some other carriers. And so you want to go with a company that's got some history and willing to share that information with you. Anything else?
Well, I was going to say, I think price stability is the most important decision. We care about what is the initial rate, but what are those rates going to look like in 3, 5, or 10 years? Because everything's going to go up, and we have to realize that medical inflation is a reality. However, if we will take the time to look at the rate history of these companies, we'll be able to see how often, how frequently, and how drastically they raise their rates. And these carriers that are more regional, smaller groups, they have less people paying into those groups. And if they have a lot of health claims, those premiums are going to skyrocket. Yeah. But if we have a large group, and that would be a national carrier, more policyholders in the group, and those health issues within the group are going to have a less of an impact.
Yeah, we had, so in Kansas City, which is where we're located, we do service all 50 states, though. We're licensed everywhere. But in Kansas City, where we were, this was 4 or 5 years ago, there was a company that if I said the name, everyone would know of this. You've heard of this company. It's a big one. But they have a bunch of regional, like smaller blocks of business. And so if you were in the Kansas City market and you were with this plan, I think this was 2018, they went up 24%. So where you were spending, $100, all of a sudden you're spending $125 for the same coverage. You should be looking for, when it comes to supplement plans, a plan that's going to maybe be 4, 5, 6%. Might be a little bit more this year because everything's kind of had quite a bit of inflation. But that price stability is important. You need to find somebody that also is not just going to be pushing one plan type.
That's right.
So we've talked a lot about supplements the last couple of minutes, but you've got Advantage plans, you've got supplement plans. Both of them are good options depending upon your situation. And so find somebody that doesn't just say, hey, we're just going to push this plan or we're just going to push this plan. No, you want to find somebody that's going to compare those side by side, go over the pros and the cons of all these options and help you understand which one makes the most sense. Okay.
Well, I was going to just add this. As a general rule, most agents, not all, but most, are going to push Advantage plans because they pay us a higher commission.
Like it's twice as much?
Yeah.
It's like twice as much.
That's reality. And so, it doesn't mean to say people shouldn't get an Advantage plan, but they need to get it for the right reason. Yeah. And not just because the agent wants to talk about it, because it pays better. Mm-hmm. My view, and yours and our whole company, is it's not what's going to pay me the best, it's what is going to be the best coverage for that client.
Right.
We have to look at that. And so that's what I was going to say. If you're talking to somebody who really cares about you, they're not going to dig right into real quickly on prices. They're going to try to understand your situation a little bit before they begin to even make any kind of recommendation. So
and that kind of leads us to the next point here, which is you find a broker, an independent broker, who can help you through the whole process.
Right.
So we've run across a lot of people over the years, and they come to us and say, "Hey, I had somebody who sold me a supplement plan." Okay, great. Did they talk to you about anything else? Well, no, they said I needed to go to Medicare.gov and find my drug plan, and I needed to go figure out how to sign up for A and B alone. Right. That is not a company or a plan or anybody that you should be working with. A good broker will help you navigate A and B enrollment, right? And understand, when do I need to enroll in Medicare? How do I get my Medicare card? If there's behind, what's the process for that? If I'm turning if I'm 68, 69 and I have Part A, there's 2 extra forms that need to be filled out that need to be, one, authorized by your employer. Get those into Social Security. So a good broker should be able to walk you through that whole Medicare A and B enrollment process. They should help you with a supplement, help you with an Advantage plan, and then help you do the hard part. And it's actually kind of the worst part of our job, is figuring out which drug plan people need to be on, because there's 30 different options. There's one plan that's best. So thankfully over the years, I remember this was like 12 years ago, we used to have paper formularies, and a formulary is just a list of medications that a drug plan covers, and we would have to go through and we'd look up, okay, you're on lisinopril, that's tier 2 in this plan, and that's a $7 copay, and then we go to this one, okay, that's tier 3, and that's a 4, and so now it's all digital. It's much easier, but still, you should be looking for a broker that helps even with that drug plan assistance this year and every year.
Yeah, I think if you have a good broker, when the call's over, everything's done.
Oh, yeah.
Yeah, A and B is enrolled, Social Security, if you want to do it at the same time. You know exactly what you're doing. Yeah. You know when the bank drafts are going to be, when the cards are going to show up. I mean, there should be no questions at all.
Yeah, it should be, hey, I'm confused about Medicare. I'm not sure what to do. And then like an hour later, it should be done. And then we always try to say what we try to do, because we build a back-end process every year for people to make sure they're on the right plan. So we have a bunch of kind of websites and stuff that work really well. We save your information. Anyway, we always say, hey, an hour at the beginning, an hour and a half at the beginning, and then maybe 30 minutes a year to double check, make sure you're on the right coverage. This should not be a long, drawn out, arduous process for most people. So, which leads us to I think the final point of what you need to look for if you're looking for a good independent broker, and that's going to be somebody who's not working out of the trunk of their car, is not a one-man band, that can really has a customer support team behind them. So we call our team, them client support advocates, because we feel like if you call in to our company and you're a client and you have an issue with a claim, or you have an issue with needing to change your plan because you moved from Florida to Texas or whatever it is, that we should be your advocate in making sure that all of that, just any changes that need to happen, are seen through, any claims issues are taken care of, and all that's free. And so that's just something that we're very passionate about, because we want 2 things, right? As a company, we want people who are going to become our client and stay our client for a long time, right? And then tell all their friends about us, so that we can help them as well. That's really what we're looking for.
No matter how a person gets their coverage, the price is always the same.
Yeah.
Right? So agents do not set the prices, the insurance company does, so the price is always the same. Whether you do it yourself, you do a call center, a captive agent, independent broker, it doesn't matter. So you can't save any money, nor will you spend any money regardless. The price is all the same. So I think it is wise for people to look and evaluate, what will this broker do for me? Right. And hopefully it's A to Z. If it's A to Z, what a value that is.
Yeah.
Anyone can write a Medicare plan, but not most people can't get you enrolled in Medicare or Social Security and really guide you through that entire process. And one thing, and I'm going to, as far as brag about this with our company, because I'm proud of our guides, and that is that over and over, every day as we get reviews, people say they were patient.
Yeah.
They answer my question. That's what we want. There's no pressure here. We really are unbiased because they've all paid the same, so it's no different. Some companies pay the same, Advantage pays the same, and so we just want to make sure that we're thorough and we're patient. Questions are answered, and why? Because you want to get on with life. You want to make a decision that you're confident with, and so we believe that we can deliver that for people. So it's our privilege to be able to do so.
Well, I think back to a lady that we hired out of one of these big call centers, and she said that they were bonused if they could make a sale in 20 minutes. Yeah. And I think that is incredibly disrespectful, right? So you're going to be on Medicare for 25, 30 years, and this person that you're trusting to help you is going to make an extra $10, $15 if they can get you through that process in 20 minutes. And it's just disrespectful. It's a terrible way to do business, which is why all these big shops are starting to crumble. But at any rate. So here's the call to action, I guess. If you're confused, if you're worried about Medicare, if you're unsure what you need to do, if you're looking for a good broker, if you need to compare your plan options, if you need help with just your Medicare questions, you can contact us, right? And we would love to help you. All our services are always free, and it would be our honor to assist you.
Hey, I do want to add, if people call, we are open 7 a.m. to 7 p.m. Central Time. So when you call in, they can get a live agent to be able to answer the questions. Beyond that, they can go online and schedule an appointment.
Yeah. MedicareSchool.com. Thank you for tuning in today. I know this was a long episode, but there was a lot to cover.